As you know, Vietnam is an emerging country, and they are faced with significant public health issues, some of them being associated with urban development. And this country has experienced a very rapid growth in the last few decades, and they are now faced with significant public concerns.
Thì hiện nay mà nền y tế công cộng Việt Nam cũng phải đang đối mặt với những các cái bệnh như là bệnh truyền nhiễm, các bệnh không truyền nhiễm và các bệnh mà do môi trường ô nhiễm gây ra. Thế còn các bệnh mà không truyền nhiễm ấy, thì là những các cái bệnh như là ung thư, bệnh đái tháo đường, thế rồi bệnh tim mạch, vân vân. Thì hiện nay Việt Nam chúng ta đang đối mặt với các cái bệnh đó. Tuy nhiên thì mấy năm vừa rồi thì chính phủ Việt Nam đã đưa những các cái bệnh mà không truyền nhiễm, bệnh truyền nhiễm vào trong cái chương trình mục tiêu quốc gia. Thế và đặc biệt là đã đưa được bệnh phòng chống bệnh đái tháo đường, phòng chống bệnh tăng huyết áp và phòng chống các bệnh ung thư thì đã đưa vào cái chương trình mục tiêu quốc gia.
The reason why the non-communicable diseases have become more prevalent in low and middle income countries is really that that people have a higher life expectancy. As we've treated infections better, people get older. The other really important factor is that we have now half of the population living in urban settings. Living in the city just means you're exposed more to non-communicable disease risk factors.
Infectious diseases, as you know, we are now facing with a different kind of zoonotic diseases like avian flu, SARS, and different kind of H1N2 and 5 and 7.
Dengue hemorrhagic fever first took place in 1958 in Vietnam and spread throughout the country. Average numbers about 70,000 and 100 deaths every year. It's one of top 10 of communicable disease in morbidity and mortality in our country.
An additional challenge in Vietnam, it comes currently still with a lot of pollution because the environmental policies tend to lag behind what can be done.
When we talk about health effects in population, we like to divide it in two types of effects. The short-term effects, meaning what the effect of changes on air pollution levels from one day to another can have. And we can see that there is increasing a lot of outcomes, for example, mortality, hospitalization, going to work, people cannot go to work just due to this one day from another change. And then there are another type of studies where they look more at what are the chronic exposure of air pollution. So those people that live longer in areas that are more higher exposed also show higher negative effects on health than those that live in cleaner areas.
So the objective of the dialogue event here today in Hanoi was really to bring together people working in different areas of health, because the global health challenge today is really at a crossroads between environmental challenges because of the new rapid urbanization, the population growth, and then on the same hand we are still facing a high burden of infectious disease and mother and child health issues, but the non-communicable diseases are really drastically on the rise, and the health services we have currently are often inadequately equipped to address these.
You see, Vietnam have started talking about dual burden of disease in the country. However, we have not yet research activities or intervention program to tackle this important issue. So this today dialogue event help us to really develop a research agenda.
To tackle the issues, I think it's very important to collaborate across all areas, political areas, to come up with policies where health is actually kept in the focus. So we need policies that protect people's health in the long term, and that needs collaboration.
Such a complexity of the world, the most effective approach is working together to address and to achieve the common goal, health of people.